Good morning. I'm here in Geneva, Switzerland for the World Health Assembly meetings, and my name is Dr. Deborah Kopalski Giles, and I'm a chiropractor with the delegation from the World Federation of Chiropractic. The World Federation of Chiropractic has been an official delegation NGO with the WHO for over 20 years, and we've been honored to work with the WHO in many areas of pushing forward healthcare, innovation, and reform. One of my favorite areas of work over the past 5 years has been working with Integrated People-Centered Health Services program at the WHO on behalf of the World Federation of Chiropractic. And this innovative work is leading out and pushing reform for healthcare so that every person around the world, no matter where you're from, has access to equitable, quality, evidence-based healthcare. And for that integrated health services, it requires coordination of health services amongst health professions and within systems and across systems, across social health systems, with publicly funded systems, private health payer systems, as well as academic training programs and professional licensing bodies. So it's really important that governments now understand how urgent it is to bring integrated services together in a coordinated way that are very focused around patients and people. In my work, I've been really pleased to have the WFC, the World of Chiropractic Profession, integrated into this work and recognized for the value it brings to the table in these integrated models of care. I've done several years of research at the University of Toronto St. Michael's Hospital in Toronto, where our practice example of bringing an integrated model of care, including chiropractic services, has been recognized by the WHO as a leading practice and by the Canadian Health Government as one of the best practice models in Canada for integrated care. And that has been pivotal for our patients who live in the inner city or from disadvantaged communities, have no affordability to receive services, to have access to chiropractic care. That access has improved their recovery for musculoskeletal conditions, in particular spine pain, neck and back pain, and really shortened their recovery periods of time, and also prevented their need to use medications which have their own complications. The patients that we see at St. Michael's Hospital are also patients who have complex health problems and mental health problems. So we often see low back pain in the context of comorbidity. That's challenging, and it takes a team to manage those patients. A team that knows the evidence, that knows what works, what's safe, and what's best for the patient, and a team that respects the patient's wishes and needs in the context of providing health care. So one of my focused areas of work as well is I'm a professor at the Canadian Memorial Chiropractic College in the research department, and also an assistant professor in the family medicine department at the University of Toronto. And I'm really proud to talk about the advances in chiropractic research that have occurred in the last 10 to 15 years. We've recently seen these breakout papers from the Lancet that have been published in the last few months, which really unequivocally lay out the importance of back pain as a huge burden globally on people, on their communities, on society, health economics, on health systems. And we now have evidence to support that. These papers call out for coordination of care and evidence-based approaches. One of these evidence-based approaches that has been established is spinal manipulative therapy, which chiropractors is their main form of treatment that they provide manually to patients. It's completely safe, it's been proven to be safe, and it's been proven to be very, very effective in the management of neck and back pain. We have a recent study published that came out of the US military program that demonstrated that when chiropractic services were added to standard medical care for people in military and veterans affairs services, their recovery time was significantly reduced, as well as the cost, and their overall improvements were greater than standard medical care alone. So there's quite a lot of evidence now that is really not refutable anymore. People who are reading the evidence will understand how that evidence builds into this whole WHO focus on integrated care for services, because chiropractic care has an urgent role to play in the management of back pain. As I said before, back and neck pain is the leading burden of disability globally, and that's published by the Global Burden of Disease Reports out of the United Nations and the World Health Organization. One of the latest publications that I'm really proud of as well is that latest issue of the WHO Bulletin that came out in May of 2018. And in this paper, it calls for reducing the global burden of musculoskeletal conditions and specifically calling out the need for integrated care, people-centered integrated care, and how you manage health conditions. And it's quite an accomplishment for the WHO to ask us to write this perspectives paper and to really push out and raise the awareness around the world to different countries and member states about the burden of musculoskeletal conditions, the significant importance of the research demonstrating the value of integrated care, and that spinal manipulative therapy and chiropractic services have a rightful place to take there. And when patients have access to those services, they're readily utilized, they're very effective, and they're very safe. So I hope this information is helpful to you in your thinking about how you're reforming and visioning your new health systems in Taiwan, and happy to be of help at any time. Thank you very much.